Hi everybody, it is Dr. Christine Anderson and I have come on to talk to you about cranial sacral therapy for newborns. That is a mouthful. All right, what is cranial sacral therapy, or CST as you will see it abbreviate? Well, it is a very gentle, non-force, hands-on approach that releases tensions deep in the body which reside in the dural tissue and the fascia. So, the dura is a tough connective tissue surrounding the brain and the spinal cord and the spinal nerves as they exit the cord. Think of it like plastic wrap, like covering, which is around your brain, and it is going to contain the cerebral spinal fluid, or CSF, that circulates around. So in a baby, you can feel the toughness of this dura when you feel their fontanelle in the top part of their skull. So I want to go right over to a couple of diagrams that I have here. So let's tune in here. Here I've got my cover page. So this is showing you the meninges, which are the dura are part of. There's two other ones, but we're going to focus primarily on the dura because it is part of the system that attaches to the cranial bones. So that's what I'm most interested in when I'm looking at the cranial sacral system. These next pictures I'm going to show you are from a huge poster from the Upledger Institute that I have in my office, but I like this one because it shows you the top part of this, the blue spherical shape, is the meninges. It's the dura surrounding the inside of the brain as well as the inner part. So I'm going to show you this paper diagram that shows you that that dura follows all the contours of the brain. So where it divides in half for the hemispheres, and on the horizontal plane, there's another division, we call these tentoriums, and falx cerebri, that dura contours in where the brain goes. So you can see that there, it's kind of translucent. And you can see it going all the way down the spine, covering those spinal nerves, all the way down to the sacrum, which is that triangle-shaped bone at the bottom of the spinal cord. So this is a continuous system, which is why we call it the cranial sacral system, because there are two components. So I'm going to go into a little bit more, but I just want to talk to you about the fascia, because the fascia, I don't have a picture of it, but it's the same type of material that covers through the body throughout the whole system, and it's the same type of material as a dura. We just call it the fascia in the rest of the body. And it's continuous from head to toe, so it really keeps us together, and it is individually wrapping our muscles and our organ systems. And then it crosses the body at 4 different points in the pelvis, the respiratory diaphragm, the top of the chest, and the neck. And sometimes these get compressed too. So this is all stuff that I'm looking at when I'm checking the cerebral spinal system out. And so let's go to the next one. This is just again showing you these meninges that are going inside. They fit inside of the skull and they attach to the inside of the bones, and those are what I'm using. I'm using the bones to work on this dura, which is inside our body. So I'm just using them as handles. I'm not really pushing or compressing. Some people get a little confused about craniosacral work because I am a chiropractor, but this is very, very gentle work. And this is showing a view if we cut right down the center. So it's a side view that you can see that blue, and there's arrows there showing the fluid, a cerebrospinal fluid that circulates from the brain all the way down the spinal cord and then right back up again. And that has to have that rhythm, that movement, or there's going to be problems. Let's go to the next one. And these are just showing some components of the skull bone. So the top left one is a top view showing a split view. So it's like looking here at the top. This is a little fetal baby skull. Whoop. So look how cute, right? They've got all their features kind of compressed here because there's no teeth. And then this is all going to fill out into an adult skull that you see here. I couldn't find a fetal one, but this is the top part. And this right here, let me try to get a little view here. This is where those four bones come together. That's where you feel that anterior fontanelle. And then the side view, so showing you the different bones there that we have. So the frontal bone and the parietal bone and the temporal bone. So we have all of those on the baby, and you can see all of these suture lines here where those bones meet. That's what we're interested in, making sure that the bones are meeting, they're moving properly, and therefore that's going to help with the motion of these cranial bones. So this is me working on a little baby, and I've got one hand under his head, and I'm checking his suck, and I'm evaluating his palate, which is part of the cranial sacral system, and I'm feeling what's happening with his jaw, and I can also direct energy through his mouth with my finger towards the back of his head or anywhere that I want to put that energy. So a lot can be done in this position. And then usually babies are happy because they can suck as well. But I'm feeling this rhythm, which is the movement of the cranial bones that is separate from respiration and heart rate. And this movement is the thing that's necessary to circulate that cerebrospinal fluid around the brain, down and around the spinal cord and back up again. If those cranial bones are not moving properly, then that CSF stops flowing, nutrients can't circulate, and toxins build up, kind of like what happens in a stagnant pond versus a flowing river. And when that CSF isn't moving on its own, babies are going to cry. They're not going to want to be put down. They're going to have trouble getting to sleep and staying asleep. And they are the ones that need to be moved constantly, right? You got to bounce them, you got to carry them, you got to swing them, vibrate them, put them, take them for a drive, and sleep on a parent because parents have a natural movement to them, and that movement will keep that fluid circulating. So, and this is what happens when you go live, and whoa, let me get that picture back up again. Wow. All right, sorry about that. Technical difficulties. Here's another one where sometimes I'm holding the baby. What they do is as I start working on them and they start unwinding, this dura that gets kind of caught and twisted will start unwinding, and you can see here the baby's arching backwards a little bit, and that is another thing babies will do to take the tension off the dura because it shortens the distance in the cord. So they like to arch, it takes the tension out, and as I have my hands on them doing the cranial sacral work, it gives kind of a latch or an unlatching effect to what's happening with the dura so that they can release it. So sometimes I have them off the pillow and I'm moving them around. And here's this little guy, I'm checking the back of his head. It's called the occiput. So it's the part right here, where this is right near the foramen magnum. This is where our brain is inside the skull, our spinal cord is on the outside, and the brain stem is right here. And I talk a lot about the effect of the brain stem because newborn babies basically function from their brain stem. This is where all the primitive reflexes are, the cranial nerves, so many involved in how they function as far as breastfeeding. They need it to swallow, to suck, to move their mouth. And so what I'm doing here is I'm assessing the movement of his occiput, and I'm at the same time holding and releasing any tension by doing that. And here I have him laying down, working on the occiput, and, I can work that way too. So it really, it just depends on what's going on. Everything is, it's personal, right? So depending on what's going on the baby. Here's another little one, little cutie newborn, and I have one hand under her sacrum, one hand under the back of her head, and she's getting sleepy as I'm working on her. And I'm feeling that whole motion around the spine, right? So I'm down at the sacrum, assessing to make sure that that's all functioning properly. All right, so let's go back here, and you just get me. So I want to just talk a little bit more about why a baby would need craniosacral therapy, because this is really important to understand. A lot of people think, why would a baby need to see a chiropractor? Why would they need to be adjusted? Why would they need craniosacral therapy? Well, the birth process, even a normal, non-traumatic, natural birth, can cause stress to the cranial structures, because basically the baby is using their head as a battering ram as each contraction surges them towards the pelvis. So this is head, pelvis, they're banging into that pelvic floor. So the optimal positioning for birth is something called occiput anterior, meaning the back of the head, right? This is the back of the head, is the one that's going to be doing the pounding and presenting. But what if everything isn't lined up perfectly? What if their head is tilted? What if it's rotated? What if instead of being flexed down, it's extended? There's going to be different stressors that occur on the cranial structures and on the neck. So that's definitely one cause of issues. A prolonged labor is where the baby is stuck in the canal for a long period of time, and that can cause excessive molding of the cranium. And this is where you might see a baby with a cone head or something called a hematoma, which is basically a big bruise from that pounding. So very quick labor might not be the best thing either, because those cranial bones are not going to have time to overlap. So normally the cranial bones are sitting this way, but when the baby goes to be born, they have to overlap and they compress, right? We want to make the head the smallest it can possibly be to fit. Any mom who's given birth will be like, yes, we do, right? Because babies' heads really, they're quite big. And this is why they have to be born at the stage they are, because if their brains got any bigger, yeah, it would be very difficult. So those bones are supposed to overlap, the baby comes out, and then they spring open and they start this cranial sacral rhythm. That's going to pump that cerebral spinal fluid around. Now, if it's a quick labor, maybe this compression isn't happening. Maybe their bones haven't had time to overlap. So that can be an issue. If the birth attendant is taking a very big hands-on approach during the birth, like using force on the head to bird the shoulders and the rest of the baby, this can create a lot of stress and tension too. And this is a very common practice, not only with OBs, but some midwives who are really hands-on. So this is another reason why a baby might need craniosacral work, or just a checkup after the baby's born. Maybe there is nothing going on, but a checkup is going to be a good idea to make sure that there's nothing big. Then there's also the use of interventions, and I'm talking about things like vacuums and forceps. That is a definite possibility of injuring, especially the dura. Think about a vacuum and that suction, right? We have a very, a skull that's not fully developed, so it's got those fontanelles, or those areas where the bones are coming together. And that area is not covered by bone. And so that dura can get pulled and tractioned while that suction is going on. So that the vacuum really does create this huge force and pulls on the dura. And I don't have the numbers, but I do somewhere. The force is really, really great. So if we can obviously stay away from these things, the better. But if it does occur, this is definitely an opportunity for creating injury. And then the forceps can come in and squeeze those bones and affect the dura and its attachment, and that certainly can injure them. Now, most people think a cesarean section, C-section or cesarean section is really gentle, right? We have an incision and everything's nice and easy and the baby just gets taken out and no drama, no trauma, right? Well, this really is not the case. It's a very small incision and it's not like everything is open. The doctor has to go in and reach in, grab what he or she can to pull that baby out. Sometimes it might be the head. Sometimes the head is stuck in the pelvis and has to be sort of twisted out or uncorked, right? So there's that aspect of possibility for trauma. And then there's the aspect of they're not coming through the birth canal, so they won't be going through this aspect of compression and decompression that we talked about with the skull. And that can be an issue for getting this cranial sacral rhythm started. Maybe they were in a breech position if they're having a C-section, or maybe they weren't in an optimal position, and that's why the labor didn't progress. That's another clue. Why did they have the C-section? And this is what I look at. So what are some problems that might be helped with craniosacral therapy? Things like excessive crying, breastfeeding issues, reflux, GERD, spit up, sleeping issues, constipation, colic, a misshapen head, a flat head, torticollis, and palsies. And I'm talking about palsies where you have a weakness of the limbs, especially things like Erb's palsy and clunky palsies, which are brachial plexus palsies that come from tractioning. But sometimes this can even help with things like cerebral palsy, which comes from areas in the brain. Now, you can't diagnose cerebral palsy in a newborn, but this is something that we have seen help older children when they're diagnosed. All right, so what does a craniosacral therapy session look like? Well, I showed you a couple of pictures that we snapped. I really wish I had a full-time photographer following me around because it's really hard to get myself to take pictures. But when a baby comes in, just like everybody else, I take a full history and I do an exam. I'm looking at their neurologic system, primitive reflexes. I'm going to evaluate their spine, their milestones, as well as do an evaluation of their craniosacral rhythm, the movement of their cranial bones, and what is going on with their suck, especially in a newborn. So like you saw, when I work on the cranial bones, it looks just like I'm holding their head. So some babies are going to cry a lot when I get on that area that's restricted as they are releasing it. It's almost like, yes, that is the spot, get on it. And so they might cry, they might cry, they might cry. And then when the release happens, it's really crazy. They just immediately kind of go limp and almost fall asleep. It's incredible. And these are definitely the times I wish I had a videographer there to document because it is so dramatic. And this is also one of the ways I can tell that babies are releasing the tension is in subsequent visits. If they were crying a lot on that first visit because they had so much tension, but in subsequent visits they start being more comfortable and not so irritated when I'm working on them, then that's a good indication that they are getting better, that they're releasing, because there's really nothing for them to cry about anymore. Now, other babies are super content when I work on them. It's just like, oh my gosh, that feels so good. And they are in bliss. And this occurs sometimes, especially if they haven't had too much trauma to their craniosacral system. And as you saw with one of the patients, some will start to unwind their dura fascia as I get my hands on them, and they just start turning and moving, and I just follow along with that. And then after a craniosacral therapy session, many babies will have a long sleep. Some parents really tell me they get concerned because, especially if their baby isn't sleeping and then all of a sudden they are, then they're like, what's the matter? Well, they're just comfortable. The tension's released. They're not being irritated by their system. So there's no need to be concerned if that happens. They're just, the baby's relieved and comfortable. Some might continue to cry and process after a session. Here's the thing is we store emotions in our body, and the only thing babies can do is cry. So it's often helpful in this instance for parents to have a bath in the evening and have low lights and just talk to the baby, maybe talk to them about the birth experience, especially if there was some trauma and drama, and especially after a particularly tough session. And it can be really healing for both the baby and the parents. This has been reported to me. So this is what I have to say about craniosacral therapy for babies. I really do highly recommend. If you have a baby or a young child or an older child even, it can happen with anybody, to bring them in to have their craniosacral system checked out along with their spine. So thank you so much. If you enjoyed this, give me a thumbs up. Please share it with your friends so that they too may understand how craniosacral therapy can help with their babies. And subscribe to my channel if you haven't done it yet. I'm on every Tuesday night at 6:30 Pacific Standard or Daylight Time, whichever one it is. And I will see you next time. Bye.